Welcome to this free voice training beginners course. During this 1-hour tutorial, you will be learning all the fundamentals of training your voice. If you would like to learn everything about this skill and use your voice like a pro, head to skillademia.com and get access to the full course. Now, let's begin.
Hello everyone, welcome back to this voice series. We meet here again now to talk a little bit more about the voice-over world and how to find out our style while providing any type of performance with our voice. We already saw a voice acting general view, how to warm up, what are the main characteristics of our voice, but here in this course we'll go deeper. We will find out how to actually improve our capacities, our abilities, other exercises that we can use so we can improve on our resonators usage, and we will understand even more how our voice box, how our body moves and works when we're speaking or performing or providing a speech or just doing a voiceover job. Get ready because this will be a lot of theory. We will have a lot of practice and a lot of activities for you to do on your free time. You will get an amazing time here, and at the end of this course, we will touch the basis for the voiceover world. Hello everyone. Let's start this model with some anatomy and theory. If you want to use your voice as your main source of work, if you're going to use your voice as your job tool, you need to understand it. You need to know how to use it and what muscles, what parts of your body are involved in the voice sound, singing, speaking, whatever your purpose is with your voice. So I will suggest you for this model to prepare. If you want to write down, do it, because I'm going to talk a lot about muscles, nerves, specific terms that might not be that easy to remember. Of course, you don't have to remember it. You just have to understand how they work together, because your main tool will be your body. So we will see how to take care of it, what are being used or what do you use when you're trying to speak, what are the main difference between speaking and singing when it comes to the anatomy of your voice and your body. Then we will try to feel it, to feel the muscles. And at the end, we will see what are those things that we need to take care about so we won't be hurt, so we don't get hurt while speaking or working with our voice. So that's the main purpose of this module. At the end, we will have 3 activities that we would like you to follow, and I will suggest you as well some things and some exercises that you can do at your home and by your own every day. Remember, if you saw my last course, you might see and you might understand how important it is to train every day. Here in this one of voice training, we will go deeper. So prepare and let's start. So let's understand the concepts first. The voice as we know it is a compound of 3 important things: the vocal folds vibration, the resonators that we used, and how we manage to pass the air through our vocal system. So today, we will manage the vocal folds, the vocal box, and I would like to give you some first concepts because I will name in this and I will be saying these names later on. So I will explain that first for you to know what I'm talking about. So the first stems that we have to take into account, because they're parts of our body, is the larynx. That's the first one. This structure atop of the windpipe is responsible for the sound production, air passage during breathing, and protecting the airway during swallowing. Then we have the vocal folds or vocal cords. It's like a fold-like soft tissue that is the main vibratory component of the voice box. Comprised of a cover, vocal ligament, and the body. Those are the parts of the vocal cords. Then we have the glottis. opening between the two vocal folds. The glottis opens during breathing and closes during swallowing and sound production. And then we have the voice mechanism. Speaking and singing involve a voice mechanism that is composed of 3 subsystems. Each subsystem is composed of different parts of the body and has specific roles in voice production. So the 3 subsystems that we have is the air pressure subsystem. We will see that one later. Then we have the vocal subsystem, which involves the voice box. That's what we're going to see today. And then we have the resonator system, subsystem to be specific. And we will see that as well later on this course. So let's start with the vocal subsystem. So the vocal subsystem has the vocal voice and has the vocal box that I told you before. So the vocal box is a compound of nerves, cartilages, muscles. Those muscles and those body parts work together to create the sound. So let's start to understand it. And the vocal box is not only for singing and talking or speaking, but it's also a part of our body that helps us for many other things. So let's see those as well. So the key function of the voice box in breathing is to open the glottis. The voice box brings both vocal folds apart during breathing. That's what they do in order for you to breathe properly. Then we also use the voice box when we're coughing. So they close and open the glottis. Voice box closes the glottis to build up pressure, then opens it for the forceful expelling of air during coughing. Then, when we're eating, we're also using our voice box. The role in swallowing is to close the glottis. The voice box coordinates closing the glottis by bringing both vocal folds to the midline to prevent choking during swallowing. And finally, we have the role in voice. The voice box closes glottis and adjusts vocal fold tension. The voice box brings both vocal folds to the midline to allow vocal fold vibration during speaking and singing. And the voice box adjusts vocal fold tension to vary pitch and changes in the volume while you're speaking or singing. Now that we understand its importance, we're going to start going one by one with the parts of the voice box. So let's just start with the cartilages that we have there. The most important ones and the ones that we use are 3 of them. So let's see each one. We have the thyroid cartilage, and this is the house of the vocal folds, so to say in some way. Then we have the cricoid cartilage. Then we have the arytenoid cartilage, left and right. Those are the main cartilages. Then we have the voice box muscles. These voice box muscles are named according to the cartilages to which they are attached. So it won't be hard for you not to associate them to the cartilages. So the first group of muscles are 3 of them. And those muscles are in charge of placing the vocal folds in the midline while we are producing sound. Those muscles are thyroarytenoid muscle, the lateral cricoarytenoid muscle, and then we have the interarytenoid muscle. As I told you, these muscles work coordinately to position both vocal folds in the midline for vocal fold vibration during sound production. Then we have one muscle that is in charge to moving the vocal folds apart when we're speaking. The name of that muscle is posterior cricoarytenoid muscle. Then we have 2 muscles that are in charge of adjusting the tension and the length of the vocal folds when we're speaking or singing. What I told you before is the pitch and the volume. So the first muscle is the vocalis muscle. The vocalis muscle alters the vocal fold tension and relaxation during speaking or singing. And then we have the cricothyroid muscle, which has an important role in high-pitched singing and a role in pitch gliding singing. It also manages the pitch when we're speaking, so it's important to know that. Now let's talk about the nerves. As you might know, the brain is the one in charge for everything that we do with our body. So we need to send the signals from our brain to our voice box so they will work together. In order to do that, we will be using two main nerves, and the name of those nerves are the name of those two nerves that we use in order to use our voice box is the recurrent laryngeal nerve and the superior laryngeal nerve. As you see in the image that I'm showing you right now, they go through our chest and they get to our neck so we can use the voice box there. And that's why it is important and risky to have any type of damage, injury, even surgery, open chest surgery. That's a very risky thing to do because any of those nerves could be damaged in the process, and that would affect our ability to talk or to sing. All of these places, all of these tiny parts of the voice box, they're so important and so delicate that I don't know if you've seen that when a singer has a surgery on their vocal folds because something happened, they had any type of damage there or disease, their voice changes because that's a delicate system and we need to use it well. Last but not least, let's talk about the vocal folds or vocal cords. So the glottis, as I told you, is the onion between those two vocal folds that we have. And the movement between them both while we are sending air through that voice box will create sound. So we have two main parts when we're talking about vocal cords, and it's the mucous or the covering of the vocal cords and the vocal ligaments. Those two work together to create this movement that we will see on the video that I will show you. So later on, we will actually see how they move in a different way when we're singing to where we are talking or speaking in a normal or in an acting way. They're pretty different if you might know or if you have already practiced some of it. So let's understand what do they do. The first one, the covering or mucous, they actually lose the structure, which is key to vocal fold vibration during sound production. And that's why we talk about having your voice box or your vocal cords moisturized all the time. I don't know if you see that when someone is giving a speech, they will drink water. Meanwhile, if someone is singing, they will have water there, or they will do some type of exercises, or they actually take care a lot of their vocal cords and they won't eat any spicy food, or if they get sick, maybe throwing up, they will take care a lot of the vocal cords because those type of substances will irritate the vocal cords and will alterate this mucous and this covering that we have. Then we have the vocal ligament. The vocal ligament is composed by the body, and the thyroid muscle is in there in the body. This muscle helps close the glottis and regulate tension of vocal fold during speaking and or singing. The medial portion of the muscle is also called vocalis muscle. I don't know if you remember, but we already talked about those two. Do you understand how all of those parts work together? Have you ever seen vocal cords moving? I mean, we talk all the time, but how does that happen? So be aware, I will show you a real voice box. I will show you a real movement of the vocal cords right now. And meanwhile, I will explain you how they work. So check this out. The front and ends of both vocal folds are anchored to the front midline. And these back ends of both vocal folds are anchored to the arytenoid cartilages. When arytenoids are moved to the open position by the posterior carotenoid muscle, vocal folds open, resulting in a glottal opening. When arytenoids are closed by the lateral cricoarytenoid and interarytenoid muscles, vocal folds are brought to the middle and to the midline, resulting in glottal closure. And if you see in the image, we have this Bernoulli effect where you kind of see like waves on the vocal cords. So later on this model, we will understand why that Bernoulli effect, that frequency, and how fast they're moving will be very important to understand pitch and also the volume. So as I told you in the introduction, we will start with the anatomy. We will focus in this time on the voice box, on our voice tools, even though all the body is being used when you're talking, when you're singing. But why is it important for you to know the name of any muscle or what part of your body is being used? Because out of knowledge, you'll be able to take care of the abilities that you have, and actually you will be able to improve on your performance. When you don't get to know what you're using while you're performing, even if it's acting with your body, if it's talking or singing, you are very susceptible to get hurt and to have a very important disease. So if we want to do this for a long time, I'll suggest you to pay attention to the anatomy of your body. As I told you before, you don't have to remember everything, but at least imagine how perfect your body is that you're able to do a lot of stuff with your voice, that you have variety of options when it comes to a proposal that you have for acting. So let's move with the anatomy and understanding what voice is. What is the science behind the voice? How does it work? And how we make it possible. If you think about this, if you think about what we can do and maybe compared to another animals, we have an advantage. We can do a lot of stuff. And you might be impressed of how many muscles and body parts are involved just in this part of your body to make the sound possible. So let's start with that part and understand what voice is.
Hi again! Congrats on getting this far! I hope you're enjoying this tutorial and already see some awesome results. If you would like to get access to the extended version of the course, go to skillademia.com where you will find the full beginner to advanced voice training course with more than 50 lectures and many more techniques to learn. Now, let's continue.
What about singing? What is the main difference between singing and voice acting itself? Actually, and to be honest, is how we use our muscles and how we direct our air column. How the vocal cords and the voice box works is pretty much the same, but they look different. Why? Because we're articulating the words in a different manner. So when we're singing, we are using our natural abilities a lot more than when we're voice acting. Let's talk about, for example, the natural range that we have. When we're singing, we want to reach notes, we want to create harmonies, and that's a different way to articulate words and sound. When we are singing, we use different resonators. For example, we talk about 3 types of voices: chest voice, head voice, and mixed voice. When we're talking about voice acting, we will be mentioning a lot of resonators because we can direct our air column to a specific place and a specific body part. Anyways, in both voice acting and singing, we use a lot of our imagination because we're working with air and with a part of our body that we cannot see. As I told you before, on singing, we want to reach some notes. That's related to the pitch. And we have genetics. Everyone's vocal cords have a different way of work, and that will give them a different range when it comes to music. So let's see the main ranges that we have on music, and you will see an example of how it sounds, and you will see a little video of how the vocal cords look on every one. So let's start. When it comes to male voice, we have the bass type of voice. That is the lowest male voice type that we have. Then we have the baritone. That is the second lowest male voice that we have. Then we have the tenor. It's the second highest male voice. And finally, we have the countertenor. That's the highest male voice type. When it comes to women, we have contralto, which is the lowest female voice. Then we have alto, which is the second lowest female voice. Now we have mezzo-soprano. That's the second highest female voice. And we have soprano, which is the highest female voice. Within each of these types of voices, we have more types of voices, depending on what notes they can reach or the color of their voice. But that's a matter of singers, and we are going to focus on voice acting. But for you to also understand, after seeing that they look pretty interesting for each type of voice, is that the muscles that we use when we're singing sometimes are muscles that we do not necessarily use when we're voice acting. For example, when we're singing, we have to use the tongue in a specific way, and usually they want us to keep the tongue down. We want to create a space. So as much space as we have, then the better. We will usually use support on our pelvic section, then our breathing muscles, then we want to use our head. This is for classical opera singers. We want to use our head voice and to direct the air column to our head. And sometimes the tongue can get in the way. Also, we're going to use the upper palate, and they want us, singers want to have their upper palate up, and that will create even more space for the sound to be clear. And if you're using chest voice or a mixed voice, it's actually a matter of how you're directing the air, how you're imagining the air that is going, and that will give you a different type of voice. But if you also think about the opera singers, and then we have pop singers, we have so different types of singing that we can actually see and that we can actually work on. And it's a matter of practice. It's a matter of understanding what are your natural abilities. And if you have that taken care, well, you can actually sing. If you're doing voice acting preparation and voice training, you're actually getting to know yourself better, and it won't be that hard for you to try to sing. So the main difference on singing, or the main details when you're trying to sing, is that you're articulating the voice in a specific way using muscles like your tongue, your face, your upper palate, and even more parts of your body. So the air can go through your voice box in a specific way. That is something different from the voice acting that we will see. But it's not a limitation for you to try it. So let's move on with the voice acting part. So when it comes to acting, we want to understand better this vocal cords movement, because I'll be talking about pitch and how to get to different types of pitch. So let's see the process again in a little bit more detail about this vocal folds movement. And meanwhile, you will see something in a video so you can guide through that. So the step number 1 will be the column of air pressure moving towards the vocal folds. Then that causes the vocal fold vibration. And that's a cycle. And let's see that cycle. The vocal folds are moved to the midline by the voice box, muscles, nerves, and cartilages. The vibratory cycle occurs repeatedly, One vibratory cycle is as follows, so pay attention. The column of air pressure opens bottom of vocal folds. Then the column of air continues to move upwards, now towards the top of vocal folds, and opens the top. The low pressure created behind the fast-moving air column produces a Bernoulli effect that I mentioned before. This causes the bottom to close, followed by the top. Then the closure of the vocal folds cuts off the air column and releases a pulse of air. That's a cycle, and then a new cycle repeats. The rapid pulses of air created by repeat vibratory cycles produce a voice sound. This voice sound, it's like a buzzy sound. So it's not that clear. That's why I'm telling you that the way we use the rest of our body will create the spoken word that we want. How the loudness gets created. So for you to get a loud voice, there must be an increase of airflow that will make the vocal folds to be wider apart. And they stay apart longer during a vibratory cycle. So this will increase the amplitude of the sound pressure wave, and that will create loudness. Then we have the pitch. This is an increasing frequency of vocal fold vibration, and that raises the pitch. So if the vocal cords are moving faster, this Bernoulli effect is being done faster, that means that you will have a higher pitch. And if they get done slower, that means that you will have a lower pitch. And with the loudness, it's the same. So now you can go back to the singing part and you can check those vocal folds movements and make a relation between this concept that I just explained to you and how the type of voice that we mentioned before can be seen in that vocal folds movement. Now, talking about the muscles that we use when talking and voice acting. When we're voice acting, we're actually not speaking per se. We are trying to project, we are trying to provide intentions through our voice, and sometimes we want to change the characteristics of the voice. The pitch, the volume, the tone. We want to sound like a different age person. And in order to do that, we have to use resonators. That it's not the type of voice that we talk about on singing, but we can talk about our nose resonator, we could talk about our head resonator, face resonator, the mouth. We have the lateral resonator, the chest, then we have the back, and we have our whole body resonator. So that's what Grotowski says, and that's the part of the articulation of the voice. And then, in order to articulate that voice and send the air to the resonators, we have to use our face muscles. And we have to move. When we're singing, usually we want to keep a technical position. And if you see singers, even though they dance and sometimes they move around, they want to keep in a specific position so they can create a big column of air. When we're acting, performing, maybe on a stage, we have to move. And sometimes the movement will cut a little bit the creation of a space. But that's not bad. That will give characteristics to our voice. So when we're acting, the conscience about what we're doing and what we want with our voice is the main difference, because we will likely use more muscles to speak and to change the characteristics of our voice. So having that in mind, first let's know ourselves. What type of pitch do you think you have? Your natural pitch when you're talking to anyone on your room. Because when we're projecting, we're using resonators, but when we're talking in a normal or on a daily basis, we're just using actually our voice box and nothing else. The air is getting there and it's not being directed to any part. Talking about the pitch that we have, it can be a low pitch, middle pitch, and high pitch. It's not as complex as the singing voice types. But I talked about the tongue and the lips when we were talking about singing. In this case, the tongue, we can use it not only to create a space, but sometimes to cut it intentionally. We can use our lips to create a darker sound, a brighter sound. We can move our mouth to make it wider or just let it closed. So on acting, we want to know ourselves so much that we can change whatever we want. It's not only a proper way of using the air, but is what are the possibilities that I have to change and to make an interpretation of any text. That's why even if we're doing voiceover projects that are in a studio, we don't have to move that much, we don't have to project that much. Sometimes we want to move because we understand that movement will give a specific color to our voice or a specific tone. So that being an introduction of what is the acting voice and how we're going to train it, you might know now that we will explore a lot so we can know each other more. So now that we saw how our body works, how that amazing nature that we have allow us to create songs or to create characters through our voice, it's important for you to know why taking care and why knowing the common damages are as important as knowing the basic technique guidelines. I will show you examples on how some specific illness or damages on our voice box can change the sound while we're speaking or singing. Air pressure system. If the airflow source is weak or inefficient, the voice will be weak and hampered by shortness of breath. So that means that it will be breathy or that you won't be able to make a full speech without your voice changing. For example, patients with asthma, lung cancer, emphysema, and other lung conditions often find it difficult to speak loud or for long periods of time. So they won't be able to maintain the vocal cords apart that long. The vibratory system. Any compromise or change to vocal fold vibration causes hoarseness and other voice symptoms. For example, patients with stiffness in the vocal folds from swelling from a common cold develop hoarseness. Another example, when vocal folds cannot come perfectly together from partial nerve input loss, a leak occurs and the voice is breathing. Then we have the effect of damages on the resonance system of our vocal parts and our vocal system. So a breakdown of the vocal tract can affect voice quality. For example, when nasal passageways are swollen and inflamed during the common cold, the voice takes on a nasal quality. So if we have something off, even if it's not a common disease of our vocal folds, that may affect our voice as well. Hormones can affect our voice. While we're eating can affect our voice. If we have digestive problems, that may affect our voice. If we're talking or singing during the morning or during evening, that will change the quality of our voice. And if we are used to talk all day and then we want to do a voice acting performance or a singing performance, believe me, the voice will be different and you might be overusing it. So if you're gonna work out of this and you're gonna live out of it, you have to rest. That's also important. So now that we know that we have seen examples, I just want you to keep in mind why taking care of your voice is as important as just learning how to use it. And now let's move on with the exercises. So you might think, why do I need to know all of this? Well, I told you before that it's important to take care about yourself, to take care of yourself, your voice box, your body, so we won't have any future problems. We'll be working with this. This is going to be our instrument. And if we don't clean it out, if we don't use the proper elements to have it in the best condition, of course, it will get damaged. A lot of singers are amazing and they have natural talent. But as they don't have the technique and they don't know themselves that much, eventually they have problems with their voice. And because of those problems, their voice will change, they will need to recur to a surgery, or they will have to stop singing that much or talking that much. And if that happens with singers, believe me, that happens with voice actors as well. Eating, doing sports, and actually drinking water are important things for you to take care of yourself. Because if you remember, we have to keep our vocal folds moisturized. And water is not the only resource that we have to keep them healthy, but the type of food that you're ingesting is also important. I told you also earlier that spicy food won't be that great for your voice. Alcohol is not the best. Smoking either, because smoking affects your lungs, your respiratory system, and the smoke can actually get your vocal folds to be dry. And if you rubber a surface that is dry, maybe your skin, for a long time, it will get burned. The same will happen with your voice. So let's see the most common damages while we're using it, and I will show you some images. Some of them will be graphic, so beware of that, and some of them are just explanatory. So, key factors for normal vocal fold vibration. To vibrate efficiently, vocal folds need to be at the midline or closed. Failure to move vocal folds to the midline or any lesion will prevent the vocal folds edges from meeting and allowing air to escape as a result in a breathy voice. The breathy voice will be something that you want, but if you don't manage that and it's just happening, it will mean that you have a type of damage on your vocal folds. And eventually it will be something that you will feel hurt about and you will feel pain for that. Then we have the pliable. The natural built-in elasticity of vocal folds makes them pliable. The top, edge, and bottom of the vocal folds that meet in the middle and vibrate need to be pliable. Changes in the vocal fold pliability, even if limited to just one region or spot, can cause voice disorders as seen in vocal folds carrying. So in this part, the epithelium and superficial lamina propria, this is from the vocal folds. Those are the key factors for us to keep them flexible. Then the tension. We need to find the just right tension on our vocal cords. If we're applying too much tension on them with those muscles, they will get tired and the vocal cords will get damaged. It's like you were hitting too hard, or when you're stretching or when you're doing an exercise and you just push yourself too much, they will break. You will have an injury. And our voice system, our voice box is just a compound of muscles, so that will happen as well. So be careful with the tension. That happens a lot when we're singing because we want to reach a high note, we think, or in voice acting could happen the same. Because we want to reach a high pitch, instead of using a resonator to direct the air in a proper way, we use the muscles of our voice box. So that tension won't get us to the place that we want and will hurt us. So be careful for that. And that's something that you can feel. And we will feel it later. Don't worry. But if you feel uncomfortable, that means that we're not using all of our body in order to speak. Because singing or voice acting shouldn't be harmful. It should be easy. And that's the technique for us to feel easy, to feel that it is comfortable for us to speak or to achieve any goal in terms of performance. And then we have just the right mass. Changes in the soft tissue bulk of the vocal folds, such as decrease of thinning, as in scarring or increase of swelling, that produce many voice symptoms when you have a disease. For example, you will have edema or hoarseness or an altered voice pitch or a forceful phonation. So you're actually doing too much in order to speak or to do something that before was easy for you. That means that there's something that is not okay. And the key players here are pretty much all of the parts of the voice box: muscles, cartilages, nerves, and the vocal folds themselves. So I would show you images of the most common disease that can happen whenever you are not using the right mass or applying a lot of tension on your vocal folds. Either they can get burned or you can create like new masses over there because of that friction, and that would not allow you to sing or speak properly or to achieve the objectives that you may have. So if you want to know more about those diseases, I will leave you links on this course so you can go and check them. You can actually research by your own. And what is very important also for you to take into account is that if you're gonna be working with your voice, you have to tell that to the doctor. You will need to get a specific exams done to your voice box so you make sure that you're healthy. And if you feel like something's off, go right away, because your purpose here is not only to learn and to practice with your voice, but for me is working with it. It's a resource. So taking that and having that into mind, let's begin with the activities. Now it's time to get our body ready, to prepare ourselves. Whenever we're going to do any type of performance, even if you're going to be static or if you're going to be moving, we have to activate our body. Not only because of our body itself, but because of our mind. So we need to be ready. What would I suggest you, and what personally works for me, is to activate my body through some simple exercises. Maybe a 10 minutes warm-up, a cardio routine, a circuit routine. They don't have to be that long. Maybe 5 minutes would be just enough for you to start sending more oxygen to your muscles, to your brain, to your organs, and actually to activate the breathing and the respiratory system. The exercises that I suggest you to do, I will give you some examples that you could actually do when you're sitting down, but as well, I will talk to you about some examples that you could do at your home if you have enough space. You don't need a big room to do this, just enough space for you to move a little bit forward, backwards, and to move your arms and your head. We want to focus when we're warming up and preparing our body on this section. From our chest, shoulders, then our neck muscles, our head, face muscles, and we want also to work our abdominal muscles and the diaphragm. So what are the recommended exercises? Running is a good one. If maybe you want to be careful with your joints, I would also suggest circuit training. Dancing is always a good option if you tend to get bored with those type of exercises. And as I told you before, training constantly would also help you to be prepared. This quick warm-up won't be a substitution for your body training, your physical training, the one that you should be doing not every day, but at least 3 times or 4 times a week. This is just for you to be warm and ready. and emotionally ready. When we're doing exercise or when we do a quick preparation, physical preparation, we're getting our mind ready for the moment and we're taking out those thoughts that won't help us to perform or to learn. So prior any training, prior any course, there's always good to do this quick physical preparation. Even if you're going to be sitting down, even if you're going to be working just in one static position, warm up. Before maybe doing the exercise, it's always good to stretch as well. Do a quick stretching, maybe yoga, that will work very well. And yoga has some static movements that will increase your heart rate, that will also be helpful for you to be ready. If maybe you are not able to do big movements because of any injury or any type of medical condition that you have, yoga will be a good option. If you want just to get ready when you're sitting down, I will suggest you to move your arms, to loose your hands, move them. This type of movements, opening and closing your hands, will help you to send blood to that part of your body. So you can do that for a couple of seconds. And we can start just with our hands. After moving our hands, we can start moving our joints. Then we can make the movement a little bit bigger. So we involve the whole arm, both arms, or we can just start with one arm. And after this movement, we can involve our shoulders as well. Movements to the back, to the front. They are not gonna be needed to be that slow. Actually, we want to increase our heart rate, so a little bit fast would be enough. Then to the back. We can move them up and down. And if you feel it, we're actually getting ready. These also help us to be focused and stop thinking of other stuff. With those type of movements, we start being present in the moment. So move your shoulders. Then other exercise will be to move your chest forward and then backwards if you're sitting down. Even if you're going to stand up, this will be a good exercise. So move your chest forward, backwards, forward, backwards. This will help you. And if you see, we don't need that big of a cardio exercise, even though sometimes it's pretty good. Back, front, back. Then to also start to move a little bit more our body, maybe we can go to one side, then to the other, one side to the other. And we can repeat this movement for a while, maybe 30 seconds, maybe a minute. And if you're not that used to make this type of movements, you will feel it. Then we can just move our arms to make bigger movements. To the back, then the other one. As I told you, at this point, what we need to activate and then relaxed is this upper part of our body. Then we can move our hands to the sides and we can do easy movements. Up and down. Up and down. Maybe 30 seconds will be okay. Then we can change the position of our hands and again, up and down. Another exercise that we can do with our arms in that position is to make circles with them to the front and then to the back. For a while, again, 30 seconds. And if you do this, you will feel that your heart is beating a little bit faster. That's what we want. We want to warm up. If you have acted before, if you're an actor, you might understand how it feels when you act being cold, to say it in some way. Because when you want to achieve some emotional state, you will need your body. And if you're not present in the moment, emotionally and physically, the body will not respond to the commands that you're sending with your brain. That's why we need to connect them both. And the warm-up is a useful, very useful tool to do it. Another thing that we can do to activate our body is to do a tongue twister. So we can start articulating a lot of our face muscles. And while you're talking, start to move a lot your face. And that will warm up your face as well. And as I told you before, it is also very important to stretch. You can stretch your arms, beginning with your arms. These easy movements will help you. And you can hold each one for 30 seconds, 20 seconds, and you will repeat it. I'm just showing you examples so you can choose whatever you think it's better for you, or you can follow me in this video if you want. Another stretch will be this one. You know, stress and working in the same position more than 4 hours all day actually generates a lot of tension. So we need to release that. This is a quick prep. The other one will be to send our hand to the back and push our elbow. Then you can change it. And you can repeat that one if you want. Then, and very important, let's stretch our neck muscles. I will go a little bit deeper forward and later on this model, but let's begin with the basic stretch exercises that we know. So we can push our head gently to one side, for a few seconds, then to the front. This is like a diagonal movement. Then directly to the front, and we push very gently with our hands. Your back should be in a straight position while you're doing this exercise, so you can feel how your back makes this stretch. Then to the other side. This is the diagonal movement. You should feel it over here when you do this movement, and even to your back, and then to the side. Remember, your head goes to your shoulder, and you should feel that here. The last one will be to send your head to the back, and you can help yourself with your hands. And you should feel that stretch here. in the muscles on the front part of your neck. So having that done, I will also suggest you to activate your muscles with little touches, not like punches, but you can just tap all your muscles. So you will activate the circulation as well. Your chest, your face, and your head. You can apply as much strength as you want. If you feel like you need to be a little bit rougher while doing the taps on your face to activate the muscles, do it. And try just not to harm yourself. So far, that would be the beginning of this training and this practice that we were doing. Let's move on with the posture. I will explain to you why it is important and why we need to keep that into account if we want to practice and actually move ourselves to make a good voice acting.
Hey there! Congratulations on completing this free 1-hour voice training essentials course. It's a pretty big achievement and I hope that you have enjoyed it. You are now ready to get started on your own voice journey. If you would like to uncover all the hidden tips and tricks of voice training, head over to Skillademia.com. The Beginner to Advanced course consists of many more hours of examples, lectures, and exercises to practice on, which will turn you into a pro in no time. You'll be able to learn the fundamentals of voice training, different breathing techniques, all about the body and movement, and the different voice styles. So if this sounds like the course for you, go check it out. Thank you for watching and see you soon.